are joined today by Donna Cooper, Executive Director of Children First Pennsylvania. In July, President Trump's federal budget bill was passed, cutting trillions of dollars over 10 years from Medicaid, Medicare, and food security. What impact does that have?
Well, it's $1.5 billion. And so what happens is there's a ripple effect. We don't know when the rubber will hit the road. But with the government shutdown, we know, for instance, that 40 million people are already suffering food insecurity, and their ability to get SNAP, or what we used to call food stamps, is going to be or may be interrupted. But even if we get past that, the changes to Medicaid are really dramatic because they require that adults with children who are older children be working. And while that sounds like a good thing, and I totally endorse the fact that people should be working to the extent that they can, even if they're receiving public benefits, not everybody can find a job. And not everybody that is of working age is physically healthy enough to work. And what we know is that when parents are uninsured, their children's health suffers. One, because they're adults, their parents' health suffers, so their ability to tend to their kids' health is weaker, and also because their relationship to the insurance system atrophies. So insured adults and parents means insured children. When there's weaker insurance among adults, there's more children who are uninsured. When parents are unhealthy, their children are likely to be unhealthy as well. And so while the intention behind the changes to Medicaid sounds simple, like people should work if they're getting subsidized healthcare, nobody disputes that. But the bright line enforcement of you only get Medicaid if you're working, without any recognition of the mismatch between skills and the labor market and people's physical capacity to work the required 20 hours a week, ignores realities on the ground that will end up harming children.
Can you give us some background on Medicaid? Who qualifies for Medicaid?
Well, basically who qualifies for Medicaid are low-income individuals. It's basically a low-income health insurance program, to put it simply. The majority of Medicaid costs are spent on older adults. So 70% of Pennsylvania's Medicaid budget is spent on senior citizens who are in nursing homes or getting in-home care. And then the next largest group of people receiving Medicaid services are people with physical and intellectual disabilities. So when you get down to women and children, or able-bodied adults, or adults of able-bodied age to work, you're at a very small percentage. Less than 20% of people on Medicaid are those that would likely be in the workforce in terms of the cost of the Medicaid program and where it's going. But when you think about the numbers of individuals in Pennsylvania, for instance, based on the federal bill that was passed, the largest share of individuals who are at risk as a result of the Medicaid changes are working age adults in Juniata County in Pennsylvania. So rural Pennsylvanians, where the job market is the most complicated to get into, and where people might not have the wherewithal to work 20 hours a week because of just physical health issues, they are going to be the most affected by the changes to Medicaid. So while we spend the most on senior citizens, they're not at risk from the changes right now. The people most at risk are adults between the ages of 23 and 65, and they are at risk if they're not working 20 hours a week, and they are most likely to be in rural Pennsylvania.
Can you talk a little bit about how the Medicaid system is funded?
Yeah, Medicaid is a federal-state partnership. And so the federal government, just at a gross level, basically covers half of the costs, and the state covers half of the costs. It's not exactly like in Pennsylvania, we might be funding 53% and the federal government's 47%, and in other states it would be different. But in general, the easy way to think about it is a 50-50 state-federal partnership. And what happens is the federal government sets the parameters for what Medicaid can be used for, and then states choose within that what to deliver. So, for instance, some states don't provide to children eye care in Medicaid or dental care. Pennsylvania does. Some states don't permit families to get orthodontic care or weight management care. So states can limit benefits within the framework of what the federal government permits. Pennsylvania's Medicaid program is a high quality Medicaid program. Families get a full suite of services, and senior citizens in nursing home get a full suite of services, nursing home or in-home. So we have a very robust Medicaid program. And the idea behind that is that the healthier we can keep people in Pennsylvania, the less likely it is they go to emergency rooms, which is the most expensive place to get health care. So having a generous health care plan is intended to keep the costs low and keep people healthy, better able to go to work, kids better able to go to school. But it definitely is different. Some states have stingier plans, but in fact, they probably are no less expensive, because when you're stingy, you see people ending up in the ER and the costs spiral from there.
What happens to kids without adequate health care?
So one of the things that we know about children is when they can't get health insurance, they get sick. It doesn't not happen if they're not insured. And if they can't go to the doctor, they're more likely to go to the ER. And so first of all, what happens is a cold becomes a pneumonia, which becomes an ER visit. Or think about it more accessibly, asthma, kids with asthma. If they're not insured, they can't get an inhaler. And so their attendance at school and their quality of life and their risk to their life is very high. We did a study looking at children without health insurance, and we found that some families were able to scrimp together enough money for one inhaler for 2 children. And so they were splitting their inhaler during the month. And so that child, one of them, was able to breathe every other day. So not having insurance is really life-threatening for children, and it's also dramatically affecting their ability to grow up and be prosperous and adults that can contribute to society. Because if you miss too much school, you fall behind. So enrollment in health insurance for children is a critical door opener to a pathway of success. Now, Pennsylvania's share of children who are uninsured has been rising. We have historically taken pride in the fact that we have a really low share of children who are uninsured. But ever since COVID, it's been really hard to keep people insured. And so we now are over 5.5% of our kids uninsured. That's about like 145,000, 160,000 kids who aren't insured. And every one of them is in a family that I'm sure would love that child to be insured, but they can't connect to health insurance. And so the complications that I described just set in. And think about it another way. If you're not insured and you're on soccer and you play soccer and then you break your arm, then you go to the ER, they set your arm. Okay, any kid goes to the ER, whether they're insured or not, right? So they get their arm set. But if something's wrong with your arm in terms of how it's set, or it doesn't really pan out well, the kid with health insurance can go back to their doctor and get things taken care of. And the kids without it can't. So we have a story of a young kid who was a soccer star in his school district. He wasn't insured. Not only could he not get his arm reset after it was not appropriately treated in the ER, his coach wouldn't let him back on soccer because he didn't want him to risk another injury. He was looking out for the kid, but that kid really, that shook that kid. And he had a really hard time in school because what got him to go to school was sports. And now he couldn't go to play sports. And it really, his parents saw a downward spiral. So, there's an indirect and a direct impact of health insurance. The obvious is that you're healthy physically. The secondary is that you're healthy mentally.
How long until we see the true impact of these cuts?
So we will not see any of the real impact of the federal budget cuts until 2027. So you could say that it was very generous of the federal government to put off the impact until 2027. That's one way to look at it. Others point out that that is after the midterm elections. And so the consternation of thousands of people who will be thrown off of Medicaid will not be extant, won't be happening until after the 2026 elections. So they really put off the pain, perhaps because they wanted to make sure that the members of the US Congress who voted for this did not have to confront individuals who are being thrown off of Medicaid while they were out electioneering for their reelection. But the fact is that a lot of people know this is happening to them right now. I mean, there are stories all across Pennsylvania of individuals who know they're going to lose their Medicaid, and they're very scared and they're very nervous about it. And again, people should not envision that Medicaid is a handout, because when we insure people, we reduce the cost for all of us. I'm on a private health insurance plan. That will cost more when we throw these people off of health insurance. So the cost of uninsured individuals isn't simply that they no longer have coverage. It's going to increase the cost for all of us.
If the government is cutting funding towards Medicaid, where is that money that is usually allocated for Medicaid going to go now?
Well, the federal budget that was passed included billions in tax cuts. And they were tax cuts primarily for upper income wage earners. People have heard that there's no tax on tips. In fact, it's only for a portion of tips earned above your in your regular time, but neither here nor there on the tax on tips. So that was sort of a talking point to say, hey, this tax bill, this is really going to go to tip workers. And a little bit of it does. But the majority of the tax cuts are really going for corporations and wealthy individuals. And so the cuts to Medicaid specifically are being used to fund federal tax cuts that were going to expire this year for upper income individuals and to expand them.
Can you talk a little bit about Pennsylvania's organization, Penny?
Yes. So when the Obamacare was passed, which is formally called the Affordable Care Act, but we call it Obamacare, when that was passed, states were given the opportunity to create what's called a marketplace, which is, kind of like a Expedia site where you go and you pick, you don't pick your hotel room or your rental car, you pick your health insurance. And when you do that, you can see plans rated by platinum, gold, silver, and bronze. And they are in accordance with federal standards in terms of how broad your Medicaid package, your healthcare package is, and like how much you're going to have to pay in and what you get out. And so Penny is Pennsylvania's Expedia, our healthcare marketplace. We can go on and choose your type of health insurance. And so if you're a young, healthy adult, you might choose a bronze plan because you're probably like, I'm never getting sick. And so you don't need that much coverage. So you want low co-pays and you want low deductibles. Whereas somebody who's more advanced in their age or tends to get sick, they'll probably want to pick a platinum plan. And what the federal bill did is eliminate subsidies that would make choosing the most robust plan affordable for every American. And those subsidies that would have made every plan on Penny more affordable for working Americans are at risk because of the Trump Big Beautiful Bill. They will be reduced. You will still get some subsidy, but you will get far less. So people are going to see giant jumps in what they'll have to pay for healthcare. And a lot of experts believe people will leave the marketplace, not use Penny, say, never mind, it's too expensive, and go and become uninsured, and then therefore drive up everybody's healthcare costs. So those subsidies are set to expire at the end of this year. It is why the federal budget has not been enacted. Whether it gets enacted by the end of the year with these continuing the subsidies at the rate that's been in place since COVID remains up in the air. But Penny is the place. Penny is the place where you make those decisions and you see what your subsidy is, so you can make an informed decision as a consumer on what's the best healthcare package for you compared to what you can afford to buy.
Now, currently, the federal government is shut down and Pennsylvania is going on a 4-month budget impasse. Does the state budget impasse have any impact on health insurance?
Fortunately, the state is continuing to pay its Medicaid bills, its CHIP bills, And so families have not yet seen an interruption in their health care. So one of the good things is that states and the federal government, the way the monies flow, we have our federal funds already for Medicaid now. Federal budgets lag behind state budgets, so this impasse is not yet interrupting CHIP or Medicaid. If the state impasse went on for many more months, or the federal did, for sure, people would begin to see a real stress. Now, that stress would first be felt by insurance companies because Medicaid is a private insurance system. People think it's government run. No, the government puts money into private insurance companies. It puts it into AmeriHealth, UPMC, Geisinger. These are private insurance companies that then recruit you as a customer. You sign up and you get Medicaid. Aetna. So Medicaid is a private insurance system. It funds a private insurance system. So the people first hit, if these budget impasses really went long, would be these Medicaid in private insurance companies. And then they would have to decide, are they going to go to the banks and get a line of credit so that they can continue to serve you or not? They probably would, because they don't want to lose you as a customer, because somebody else could do it. So the competitive private market is somewhat protective of citizens during government dysfunction. And that's why, again, individuals who lambast Medicaid as a government insurance program miss the point. It's government funding a private insurance system that gives consumers a choice to pick the best plan for them.
How are hospitals impacted by the Medicaid cuts?
Oh, well, it's a very tough situation for hospitals in Pennsylvania based on the administration's big, beautiful bill, because they know that as individuals lose their health insurance, let's say there's 11,000 people in Juniata County that are going to lose their health insurance. I mean, that's just an estimate, not accurate. Just saying that's a number, 11,000, Juniata County. The hospitals in Juniata County know these people will still get sick and walk through their door. And so they're going to come in as an ER patient. They're not going to have any money behind them. They may need to get admitted to the hospital. They may have serious needs. They may have cancer. And the hospital's still going to treat them. And so the costs for hospitals in uncompensated care will skyrocket. Pennsylvania hospitals are already bearing about $1 billion in uncompensated care now for uninsured people. Half of that money is for uninsured children, meaning we already in our healthcare system have services being paid for which no one is paying the bill of nearly $1 billion. Now the state and the federal government have what's called an uncompensated care payment system, and they offset some of that. But the Medicaid changes are going to dramatically squeeze that uncompensated care reimbursement system while we're driving up the number of people who are going to be walking through the doors without an insurance product behind them. And so rural hospitals, particularly, who are already teetering on the edge because they have uninsured residents in their community walking through the door for no payer now, they can't take more. They will close. So the big, beautiful bill included, if I remember correctly, a $50 billion, I think, 5-year fund to help rural hospitals be able to absorb, in essence, the sticker shock of all the new uninsured folks walking through their door. Nobody in Washington thought that was sufficient money. Everybody understood that to be a talking point that would cause them to get out of Washington on time, but not save their rural hospitals. And it's why you see strong conservative Republican senators like Josh Hawley and House members like Marjorie Taylor Greene worried about the big, beautiful bill because they come from rural communities. Their rural hospitals were already at risk, just like ours in Pennsylvania. And they know that that fund, coupled with the stringent work requirements that are in the bill, will mean that their hospitals are going to likely close. And then people have to drive for hours to get to see any kind of medical professional. And that becomes a downward spiral for communities. One of the things about Medicaid, enabling people to have access to healthcare where they live and keeping rural hospitals alive, people don't want to live in a town that has no health care, and they move as a result. And so rural America and rural Pennsylvania are particularly at risk as a result of the Medicaid changes in the big, beautiful bill.
What is the state legislature doing to address these cuts in health care funding?
So the state can, if they wanted, say, look, federal government has work requirements. We're going to say, if you don't meet those work requirements, we'll cover your health insurance. So if you can't find a job 20 hours a week because of your physical disabilities or because there's no jobs in your community, we can fund that. That is billions of dollars. So the likelihood that states will step forward, and particularly Pennsylvania, to do that, I think is quite slim because state budgets are required to be balanced. It's not like the state can do it and run into a deficit and finance the deficit. The only unit of government in America that is permitted by law to run a deficit is the federal government. So cities can't do it, the state can't do it. So the likelihood that we can come up with a way to enable people to get access to health insurance, given the federal changes, is pretty slim. There was a program that was eliminated first under the Ridge administration partially, and then permanently under the Corbett administration, where there were a set of people which we called general assistance individuals. They were working adults who could not sustain work for a variety of reasons, and we funded their health care, and Pennsylvania did, Pennsylvania funded their health care, and it was, I can't remember the numbers, but it was limited, so there was a waiting list. You wouldn't automatically get it, and it was in the hundreds of millions of dollars. And you know that the state budget impasse right now is about how much the state is spending. The state's last year budget was $49.7 billion. The increase year over year of going to $50 billion is associated with rising Medicaid cost. So and we have an impasse now for 4 months. So the likelihood that Harrisburg would step forward and go further is pretty slim. And let me remind you that increase in Medicaid spending is primarily due to the fact that nursing home costs and in-home care costs for elderly and those with intellectual disabilities is rising. That's 70% of the Medicaid budget. And so we, as Americans, we're compassionate. We want to take care of people with intellectual disabilities and senior citizens, but it's not free. And at this point, it is the reason that our state budget isn't passing. So the likelihood that people who are working age are going to see a relief from the state, given already the pitch battle over state spending, I think is slim in Pennsylvania.
What options are available for anyone who finds themselves in a situation where their Medicaid is getting cut, especially those with children?
Yeah, so first of all, children remain insured. So it's really important that families, if you're a parent and you lose your health insurance and you're on Medicaid, make sure you sign your kid up in Medicaid or CHIP. There is no change in the federal law as it relates to children. So please spread the words in your community. If you're part of a faith organization or a fraternal organization, do what you can to reach out to families in your community, just like people are doing now with the SNAP cuts of putting food together. Make sure everybody knows their kids can be signed up for Medicaid and CHIP. Number one. Number two, if you as a parent or an adult lose your access to healthcare, you may have a federally qualified health center in your community. They're all over the state, but there's not a ton of them. So you want to look online for a federally qualified health center. They will see you regardless of your insurance coverage. If you're in one of the counties in Pennsylvania where you're lucky enough to have a local health department, you also are likely to be able to get services via your local health department through a clinic that they probably fund. So you're looking for free health clinics, you're looking for federally qualified health clinics. And then after that, most of in every county, we have something called a community action agencies. And were founded in 1965 to launch the war on poverty. But they are organizations that adults can reach out to, and they may know, is there a medical provider that's willing to see people who are uninsured? Is there a dentist? Is there an eye doctor? So it's important to recognize that there are people in your community who for years have been helping uninsured individuals sort of get a little bit of care from providers. And then ultimately, if you're sick, go to the ER.
Lastly, do you think that once we have a new administration, that will get funding back for Medicaid, or is this a permanent end?
So I think that the question is, how do states implement the Medicaid changes? If, for instance, states are very stringent in evaluating what counts as the 20 hours of work or education, if states are not able to identify individuals who have physical ailments that prohibit them from working, then the hue and cry to reverse these federal changes will be great. And I would imagine that some of the states that will be the most rigorous in enforcing the federal laws to the letter of the law will be southern states, where they have also not expanded to the Affordable Care Act, where they're doing everything they can to constrain state funding and limit access to healthcare. And I can't even begin to understand that one, but let's just say that's happened. I think in those states, they will be very rigorous in this regard. And we're not suggesting any state would break the law, but there is some flexibility. So those states that exercise the least flexibility are also the states where the lawmakers voted for this package, which were red conservative states. I would imagine that the healthcare systems in those states, the insurers, and the parents are likely to make it uncomfortable for their lawmakers to not reverse these changes. Will it happen? I don't know, because I do think that New York and California and Pennsylvania and in Illinois and other states, the governors in those states are going to do everything they can to keep people health insured, because they know that keeps my health insurance premium down as a private payer, that it's better for the system, and of course it's better for people. So that sort of ideological difference in terms of how you're going to administer this new federal law is going to be critical to whether there is a re-examination. Now, if Congress flips in the midterms, that may be the moment in which they change this. Because if the flip is understood to be about the fierceness of these Medicaid changes and the lack of compassion that they are causing and the economic ripple effect that they will unleash, there's a good chance that Marjorie Taylor Greene and Josh Hawley are going to be at the front of the call to reverse these changes, and they will have ready partners with the minority party, which already voted against these changes on multiple occasions.
We've been speaking with Donna Cooper, Executive Director of Children First Pennsylvania. Thank you for your time.
Thank you. Great to be here. I'm thinking, oh, what if it was like 1,000? That would sound crazy. Can you give me 1 second? Let me just look it up.